This holiday season is being spent very differently than what we're used to. Little to no family and friends or Zoom celebrations have taken the place of normal family traditions. That's because many of us are doing our part in slowing the spread of the deadly COVID-19. Shatanya Clark tells us why officials at one local hospital hope their PSAs can help bring awareness.
My husband said I was literally lifeless.
Inform and educate. That is what Carrie Hawkins and others at Wilbarger General Hospital hope to accomplish by releasing PSAs where COVID-19 survivors like Katherine Johnson share their personal journey with the virus.
I'm amazed at how many people are not wearing their mask, and this is something you do not want. I'm in my 9th week, and I may today go home and be doing something at the kitchen sink and just suddenly not have any energy to get to the chair.
In the PSA, Johnson says her husband believed he contracted the virus at a gathering. They were on their way to an event to support their granddaughter when they both felt sick and decided to turn around.
By Monday, he had tested positive, and Tuesday, I tested positive.
Hawkins says these PSAs were created so people like Johnson can share their stories and hopefully be a lesson for others in the community.
We're hoping that people see and hear these stories from their friends and neighbors, the people they recognize, the people that have taken care of them when they've been in the hospital for other reasons maybe. But the goal is that to educate the public on the realities, so maybe they take more precautions to try to slow the spread.
One frontline worker who has dedicated her time caring for folks fighting COVID-19 found herself battling the virus, but took advantage of a new treatment the hospital is administering.
I have an autoimmune disorder. I have rheumatoid arthritis, and I take a medication that weakens my immune system. My coworkers, knowing I had that, called and said, "Hey, do you want to do the infusion?" And my first thought was absolutely.
Our chief of staff, Dr. Lehman, is really keeping up with the latest in the treatments. He stays on top of it. He has started administering the monoclonal antibody treatments, the outpatient infusions to patients that are early on in their symptoms.
Hawkins says everyone at all levels are trying everything they can for the people they're seeing at WGH.
The nurses go above and beyond. They go that extra mile. It was amazing how well I was treated.
Hawkins, Dwyer, and Johnson say their hope is people will take this virus, which has claimed so many lives, more seriously. Shatanya Clark, KFDX 3 News.